नमस्कार। भारतीय पुनर्वास परिषद की ओर से आयोजित इस टेलीकॉन्फ्रेंस में मैं आप सभी का स्वागत करती हूँ। आमतौर पर जब परिवार में कोई मंदबुद्धि बच्चा होता है तो माता पिता को ये चिंता होती है कि उन बच्चों को किस तरह से पढ़ाया जाए, किस तरह की ट्रेनिंग इनको दी जाए। और जब स्कूल में इन बच्चों को भेजा जाता है तो वहाँ भी शुरू में काफ़ी कठिनाइयाँ आती हैं। कई बार ये कहा जाता है कि बच्चों को स्पेशल स्कूल में भेजा जाए, कई बार होता है कि बच्चों को एक सामान्य स्कूल में अन्य बच्चों के साथ पढ़ाया जाए। तो ऐसे वक्त में माँ बाप बहुत कंफ्यूज हो जाते हैं और उनको लगता है कि क्या किया जाए। तो आज हम इसी विषय पर चर्चा करेंगे कि मेंटल रिटार्डेशन जिन बच्चों को है उनके एजुकेशन के लिए हमें किन बातों का ध्यान रखना चाहिए और व्हाट आर द बेस्ट प्रैक्टिसेस इन टीचिंग चिल्ड्रन विद मेंटल रिटार्डेशन. And today, to give us information, we have the honor to have Dr. P. Jayachandran with us. Dr. Jayachandran is a well-known figure in the area of disability. He is head of Mental Retardation Committee of RCI. He is working in this field for last 38 years. He possesses the master in special education and PhD from University of Minnesota. He has done his MA and MLit from Madras University. He got National Award for Best Individual for working with children in mental retardation in the year 2003. He is a visiting professor in Germany. He has trained more than 1500 special educators in the area of mental retardation. He is proud to say that he has tested 28,000 children with mental retardation and guided their parents. He is the first one to develop assessment scale in India that is called MDPS scale. And he has also developed special education curriculum and a guidebook for persons in teaching yoga. Our other expert is Mrs. Janki Balakrishnan. She is MA MPhil in psychology. She is working as a visiting lecturer in Balavihar Training School, Chennai. This school is the oldest school in the area of mental retardation. She is a mother of a slow child and she is working in this area for last 8 years. I welcome both the experts in the studio. कार्यक्रम को आगे बढ़ाने से पहले मैं आपको स्टूडियो के नंबर नोट करा दूं. हमारा टोल फ्री नंबर है 1800112345. STD नंबर है 01129532844 295328845. एक नंबर और है 29536131. इग्नू स्टूडियो का फैक्स नंबर है 29536134. आप फैक्स के द्वारा भी अपने सवाल पूछ सकते हैं. Before starting the program, I would mention that we'll try to keep a balance of both the languages because our experts are from South and there are viewers who have problem in English. And now I would ask Dr. Jayachandran, what are the best practices in teaching children with mental retardation?
The best practice in teaching children with mental retardation are innumerable. Over the years, we have developed quite a lot of methods, strategies, and also systems. And before going into those details, I think I must tell even this IGNOU program with RCI is also a best practice because this viewers, professionals, parents, and all the well-wishers for persons with disabilities, they can also learn many of the things and get it clarified in future with some expert who is there in their vicinity, living in their vicinity, because the people, what we say in the next 60 minutes may be a kind of outline, but definitely you can learn more things, and we will be too happy to share our experiences in the program.
Yes, sir. Yeah. Usually, when we talk about best practices, then what are the things that we should keep in mind before planning a program? Janki, would you tell our viewers?
Yeah, can I proceed? How to second what Sir was saying, whatever is happening in the country, it's good. We are more becoming aware to train these children, but more I see it's a kind of a voluntary help than a professional help. He has developed a tool. The process is going on, and there are whatever has to be done for these children with right kind of strategies and methodology. Everything is on. In theory inputs, it is given to the teachers. But for a practical level, if these teachers would imbibe whatever is given to them, imparted to them in their training, and would actually take it in imparting the training, that becomes best practices. And I would like to proceed with before we get on, I would like to proceed with the PowerPoint show slide so that we can have a better idea and start from it. I invite Dr. Jayachandran to proceed with this.
Can we move on to the next slide, Janavi? Yes. See, when you work with in the field of mental retardation, and I think we should know to whom we are working, because many definitions are there, and PWD Act says these are the disabled people, and many more people they have come, and they say our people should be also included in their field. There's a lot of confusion in that, but a person working in the field of mental retardation, we have very, very clear understanding that if a person scores less than 70 in IQ, but according to the recent definition, it could go up to 75 because of the standard errors, but that should be on a standard intelligent test. And if they have problems in performing the daily living skills, these two should have occurred before the age of 18. Why I said this? We are limiting our discussion only to these people who fall into this category of category. So the next slide means, yes, standard intelligent test, yes, you should have for legal purpose. But as a person working in the field of mental retardation, whether you have the intelligent test or not, you should be in a position to work, because we don't enter into the debate that intelligence could be changed, not changed, its constancy, all those things we need not worry. The problem with them is they have problems in doing the daily living skills, adaptive behavior, or activities of daily living. Because of that, since they have problems in that, they are depending on others to do the work. If you could help them to do those activities, they will be less dependent, if not totally independent. We make them independent in many skills. We make them less dependent in some skills. We may fail in some skills. We need not worry about that. We can definitely make them less dependent in all the activities, whether it is functional academics or vocational or any other daily living skills. That's what the adaptive behavior talks about. Next one, Jani. Next one, please.
Next slide.
Yeah, I put.
Yes. The slide is not that clear, but the thing is, these adaptive behaviors are definitely developed, age appropriate, need based, and level based. And for this, all the persons working in this field, they have spent enormous amount of time to say what kind of skills they are supposed to do in this period and this period and this period. And now there are some best practices. There's a caution. This mostly for the parents. I will say, if they are viewing that the best person with mental retardation can go up to 4+ level of education. 4+ means some may go up to 8th standard, some may go up to 10th standard. But conceptual learning, they will go up to 4+ level. Keep 8th standard as the cutoff point. Then the next level, persons with mental retardation can go up to 2nd grade or 3rd grade. Maximum, if the teacher's skill, they can go up to 4th grade level. And the other group, they will be learning only the activities of daily living. And they will be learning that to some extent, less dependent when they are about 18 years of age. That's the developmental period during this time. There are a lot of skills in that to teach and learn, and that will be done by them, by the teachers who are trained, special educators who are trained for that. Probably we move the next slide to show this. And Janaki, yeah, okay. The next slide, this is the crux of the problem. This is the key problem in the field of special education or in the field of mental retardation itself. Earlier, there was only the care and management. Just they were given custodial care. That's not the best practice. But custodial care will also be given those who need that. But can you go back to the flow chart what we have, Janavi? Yes. In any program, if they follow this, the slide is not that clear, but anyhow, I'll tell you, there are 3 steps in the program, the best practice, whatever you call. One is the assessment, the second one is setting the goals and objectives, third step is evaluation. If someone is following this in any center for persons with mental retardation, that center is following the best practice. This assessment, setting goals and objectives, and evaluation is the key for any program in the field of mental retardation. This may be called as a result-oriented management system also. Earlier days, parents will say, I am sending my child for the last 20 years, and the child, how is the child? Child is okay. That's not the thing. In this system, it's very clear that when the child enters the school, the parent should be told what skills the child can do at that time, what the skills are performing. The next step, in the next 3 months, the next 3 months, I have set these goals. I have written these objectives. For that, this is the teaching procedure. And then after 3 months, the child will be evaluated and the progress will be given to the parents, funding authorities, or anyone who is the accrediting organization. To do these 3 activities, we have probably a standard assessment tool, and that should be recorded in a behavioral profile. And the next one, to record the individualized program plan or the quarterly program plan, you have someone is asking,
Yes,
you must
yeah.
speak in Hindi also.
Yes.
Dr.
No, I
Hemalata will translate that in Hindi. Don't worry, you will listen to that, and that will be done in the individualized program plan, and quarterly evaluation also will be done. And if you have an interdisciplinary team of experts, you will use them for assessment, setting goals and objectives, and also for evaluation. And I must tell this, we will go to the next slide and stop what are the scales available. Okay, this is an assessment in a homebound situation. The left hand side, the person sitting is a special educator, father, mother and the child. When in those days, probably we never had early intervention program, the teacher used to go to the homebound program, do the assessment, evolve the program and give it to the parents. I think someone asked for a Hindi translation.
now I
Probably
will
Dr.
translate.
Hemalata
Yes.
will do that for us.
Now I will translate. डॉक्टर जयचंद्रन और जानकी ने अभी हमें बताया कि मेंटल रिटार्डेशन की पहले पहचान करने के बाद हमें किस तरह से उसका असेसमेंट करने की ज़रूरत होती है. डॉक्टर जयचंद्रन ने कहा कि 70 IQ अगर होती है 70 से 75 तक, तो उस वक्त हम मान सकते हैं कि बच्चे को मेंटल रिटार्डेशन है, और उसको पहचान कर उसके बाद हमें ये ज़रूरत है कि हम प्रॉपर असेसमेंट करें. असेसमेंट करने के बाद ये ज़रूरत है कि हम उस बच्चे को क्या सिखाना चाहते हैं, कितना उसको आता है, ये हम असेसमेंट में जान जाएंगे. उसके बाद हम अपने गोल्स और ऑब्जेक्टिव सेट करेंगे कि हम बच्चे को क्या सिखाना चाहते हैं, और उसके हिसाब से अपनी प्लानिंग बनाएंगे, जिसके बारे में हम अभी आगे बात करेंगे. और उस प्लान बनाने के बाद बच्चे का हमें आगे ज़रूरत होती है कि हम उसका इवेल्युएशन करें, ताकि हम ये जान पाएँ कि हाँ, हमने पिछले 6 महीने में या पिछले 3 महीने में बच्चे को क्या सिखाया है, किस स्तर से हम कहाँ किस स्तर पर पहुंच पाए हैं, कौन सी एक्टिविटीज़ वो सीखा है. दूसरी जो एक इम्पॉर्टेंट बात डॉक्टर जयचंद्रन ने बताई वो ये थी कि ये जो बच्चे हैं एजुकेशनल एक्टिविटीज़ में 4+ क्लास तक जा सकते हैं, और ज़्यादा से ज़्यादा 8th क्लास तक ये बच्चे जा सकते हैं. अभी हम आगे बात करेंगे कि असेसमेंट किस तरह से किया जाए, उसके बाद मैं आपको फिर से इसका हिंदी ट्रांसलेशन करके बताऊंगी. Now I would ask Dr. Jayachandran to go further.
That IEP.
Yes.
That
You tell about IEP.
I told, but the
Yeah, I
assessment
told.
and- okay.
Yes.
See, my ignorance in Hindi that much. Maybe someone should program it for me also to learn Hindi. And I'll tell you, in this country, though personally I initiated the first assessment tool in the country, that's called Madras Scale in those days. Then it became Madras Developmental Programming System later. Then that was initiated sometime in 1968. Many of you watching the program would not have been born by that time. And that was developed, revised, reviewed and updated, and it was going on with the help of all our old students, particularly Dr. Jayanti Narayanan, who is heading the special education department, and with their help definitely we revised that many times and updated that. Then in 1991, to my knowledge, if I am correct, a National Institute came with 2 scales. One is functional assessment checklist for programming and the behavioral assessment scale for Indian children having mental retardation. And these 3 scales, to my knowledge, is standard scales it could be used. Once you use the scale, set the goals and objectives, then write out the teaching program, give it to the parents or give it to the people who are taking care of them in the residence. They will reinforce it. After 3 months, you evaluate that in the presence of the parents or the funding agencies. Prove to them that what you have achieved in the 3 months. If you fail, you must tell why you have failed. I can give a small example. We had a Marwari child. As I have difficulty to communicate to you in Hindi, he had difficulty to communicate that to us in Tamil. It took lot of time for us to, because they have settled down in Chennai. So we taught him Hindi later. We taught him through some Hindi teacher, which I have not learned, but that's the truth. So, but the thing is, he has learnt it and we started teaching him. Sometimes we may fail to achieve that skill in the next 3 months. And one small thing, this is highly philosophical and a highly debatable point. The 2 scales what you have using Madras scale and the functional assessment scale, very, very good for the teachers to do in the classroom program and also for the parents to do it in the house. When you come to behavioral assessment scale for Indian children having mental retardation, it's good. It's good for using, but it's a little more complicated because it's mostly used in clinical setup. That's my opinion. And also, heavy load is given to problem behavior management, which I totally disagree personally in my capacity working in the field for about 38 years. Don't see the children with mental retardation as problem children. They are developing children. They are learning the skills. And if you give a checklist, these people have problem behavior checklist, and they will have, say you list about 30 problem behavior, the parents or the teacher will mark 28 problem behavior. How can you spend so much time in eliminating the problem behavior, which is not a problem behavior? If you use the scale for yourself, you will know that probably you may be doing all those problem behavior. Problem behavior is the one which prevents his learning or which prevents somebody's learning. Maximum any person with mental retardation, that too in the total population, a negligible population will have problem behavior. That too they may have one problem behavior. So this scale helps people to identify mostly the problem behavior. To my personal opinion, it's not good. But I would like to state one thing. The definition on mental retardation, education moved away from the medical model. Medical model means that is treatment model. Whether it is medically treated or psychologically treated, I am telling treated, like behavior therapy, taking the person, making him to sit in one room and do some kind of intervention, that has been moved away long back. It is educational model. If you have problem to learn, go to a teacher. But if you have a problem, definitely medical problem, you go to a doctor. But here, why I say it's not a medical problem. If the child fails to learn geography, there is no pill to prescribe. Go to the doctor, he will prescribe a pill, take this geography pill, he will be all right. There is nothing like that. A special educator has to work out the lesson plan and also should say, okay, if the child fails to learn, the special educator always asks the question, how my lesson plan prevented the child from learning. We don't say, the child is Mandabudhiwala, he will not learn. That is totally wrong. It is unethical for a special educator to say that the child has failed. No, you have not evolved your lesson plan to make the child to achieve success. That means you must structure your lesson plan in such a way that you allow the child to succeed in one level so that the child can go to the next level. This is key to the best practice. I really tell you why we say the child has failed. Because you have not given them the task which the child will accomplish.
I would like to add on, Dr. Jayachandran.
Please.
If a child is posing a problem in the classroom, mainly it is because of the lack of opportunities given to that child. That the child's learning potential is not brought out. So that because the state of helplessness, the child is posing a problem. It should be looked in that way, more than seeing in a person what are the problems in the person. If you think as a teacher, if you think that have you provided adequate opportunities for learning and self-expression, and if maybe probably the child is having some kind of difficulty and not able to express, the child is always jumping, and I say the child is always jumping and not sitting for learning, then I call it a problem behavior. It's more than how the way we look at it and understand and facilitate the way for the child to express itself, and then automatically these problem behaviors limit. So
थैंक यू
it's-
जानकी।
yeah.
अभी डॉक्टर जयचंद्रन बता रहे थे कि जब हम बच्चे के लिए एक इंडिविजुअलाइज प्लान करते हैं कि उसमें हमें ये देखने की ज़रूरत है कि हम कितने अच्छे तरीके से बच्चे की पोटेंशियल्स का इस्तेमाल करके उसे हम कुछ सिखा रहे हैं। ऐसा ना हो, कई कई बार ऐसा होता है कि हम प्रॉपर टीएलएम इस्तेमाल नहीं कर पाते, टीचिंग मटेरियल हमारा उतना अच्छी तरह से नहीं हम डेवलप कर पा रहे हैं, या एक स्पेशल एजुकेटर की प्लान में कुछ इस तरह की कमी रह जाती है कि वो बच्चे को नहीं सिखा पाता है। हम ये ना कहें कि हाँ बच्चे ने कुछ सीखा नहीं है और वो प्रॉब्लम बिहेवियर कर रहा है। जैसे जानकी अभी बता रही थी कि प्रॉब्लम बिहेवियर कई बार बच्चा इसलिए कर पाता है कि हम उसको प्रॉपर अपॉर्चुनिटीज़ नहीं दे पाते कि वो अपनी पोटेंशियल्स को यूज़ कर सके। तो ज़रूरत स्पेशल एजुकेटर को इस बात की ज़रूरत है कि वो बच्चे की पोटेंशियल्स को लाने के लिए, एक गोल को अचीव करने के लिए उस सही तरीके के टीचिंग लर्निंग मटेरियल इस्तेमाल करके उस बच्चे को एक लेवल तक पहुंचाए, उसके बाद दूसरे लेवल पर जाने की बात करें। अब हम अपने अगले सवाल पर चलते हैं। नाउ आई वुड आस्क जानकी, व्हाट आर द प्रोग्राम कंसिडरेशन बिफोर प्लानिंग?
Yeah. There are number of strategies that we can really work on, but broadly we see it as, when thinking on program considerations, we categorize them as broadly as normalization consideration, then
Jani, put that on the scale. Okay, wonderful.
then instructional consideration and environmental consideration. If you can see the slide, in the normalization there are a number of strategies put under them, under each of them. It's like normalization is like what if a child, a disabled child or a normal peer should have a normal exposure or normal experience like what we have. That's what it means. So whatever the normal peer is having, that same kind of experience, this disabled child is also entitled to have that same kind of experience. So considering the program, and then also we must also think about the non-handicapped peer also. Something we are trying to create for a handicapped child, and it is posing a problem for a non-handicapped peer to gel with that program. That point also we have to bear in mind, because especially the momentum now is talking about inclusive education. So all these things we have to bear in mind. And definitely for the special child, they are also human. We have to think about their privacy, their appearance, because they do not express and they do not seek what they want, and they do not so we also have to think about, from their point of view, they also need privacy, they also need to look well, to move with people well, all those kind of normalized environment for them. And then when we go on the instructional considerations, these, like whatever activities that we plan for them, it should be a variety, it should be flexible, and it should also have goal oriented, and it's it developmentally sequenced. And there are a lot of strategies like this I would like to show on the slide. I have just enumerated the number of strategies, and also in environmental strategies broadly, like we also have to think at a micro level. We talk about so many strategies, but at macro level we also should think, what as a teacher, whatever I am doing within this classroom setting, how it is going to facilitate the larger goal also. Like when macro level, when we think, it is more on policy initiatives, your school administration policies, and economy and community support, and also parent support. This is how it goes.
Can I take a lead from what I think Janaki put all those things in one slide.
Yeah, sir, we will take the call. Yes. Hello.
Good afternoon, ma'am.
Good afternoon.
We are calling from the Spastic Society of Tamil Nadu, Chennai.
Yes.
The program is very good, ma'am.
Yeah.
But we are not able to follow it. The transmission is not. It is interrupted actually.
Okay. Do you have
And we are
any
not
question?
able to follow it up.
Karthik?
No, not at the moment, ma'am.
Okay, so that we can't do anything. If you have any question, you ask, and we will ask the IGNOU people to
Transmission, they have problem.
take care of that. Okay, sir, you can go
I
ahead.
will just highlight one point from each, probably simple points. In normalization, we talk about appearance. For example, if the child is clean, if the child is not smelling bad, any teacher will go hug the child, take the child and play with the child and try to impart this learning to the child. If the child is really smelling very badly, some parents, they don't brush the child in the morning and send the child to the school, and it's going to be a little difficult. So if the child is really good, appearance is good, people work. That's also a normalization consideration. We insist in the evening just to tell the parents that this is how the child should come to the school. In the evening we spend about 15 minutes and make the children to wash, groom themselves, apply some powder so that even the sweat smell will not be there, and that is how we send. This is one of the good practices in special education. If you send your children, if the special educators take care that the child is clean, probably the child will have more time to learn from the teacher. That's what I think. Then another thing, alternate activities. This I do not know. The clock is running very fast, or we are slow, we do not know. But alternate activities in working out the timetable, we will talk about that briefly. But in many schools, reading 40 minutes, writing 40 minutes, number 40 minutes, like that if you give, it is easy for the teachers, do it like that. But if it is reading, then try to give some gross motor function. I am just giving, all the classification has gone differently, but I am giving an example. Then if you give writing, then you give fine motor. And before eating, that you give yoga classes for them. Like that, if you structure your timetable with alternate activities, then the children will be highly motivated, definitely. Then one more thing, I saw the safety hazards. Safety is the prime importance in our program, in best practices. Safety in the classroom, safety on the road, safety in the bathroom, safety in the kitchen. Safety is predominantly goal number 1. Then only you talk about the other programs. And I really tell you, just for like any other Indian, I thought our students should learn about 108 teaching strategies. So we have written about 108 strategies in simple form so that the students can learn and they can explain to the parents. So if you explain one strategy, it may take 1 hour. So we skip that and go to the next one. Madam?
Yes.
Right.
Yeah. मैं थोड़ा ट्रांसलेशन कर देती हूँ. डॉक्टर जयचंद्रन जैसे अभी बता रहे थे कि प्रोग्रामिंग कंसिडरेशन में हमें इन बातों का बहुत ध्यान रखना चाहिए कि जैसे एक तो बच्चे की अपीयरेंस, अगर बच्चा साफ़ सुथरा है तो टीचर का भी मन करता है कि वो उसके साथ काम करेगा. कहीं ऐसा ना हो कि हम बच्चे को, क्योंकि बच्चा मेंटल रिटार्डेशन है बच्चे को, तो हम बच्चे को साफ़ सुथरा ना करके भेजें या स्कूल में इस तरह से भेज दें. ग्रूमिंग स्किल्स और बच्चे की अपीयरेंस बहुत ज़रूरी है उसकी बेटर लर्निंग के लिए. उसको भी एक अच्छा कॉन्फिडेंस उसके अंदर आएगा और टीचर भी उसको एक अच्छे तरीके से सिखा सकेगा. दूसरा, आपने बताया कि ऑल्टरनेटिव एक्टिविटीज़ की भी बहुत ज़रूरत है जिससे कि बच्चा सीखने के लिए मोटिवेट होता है. जैसे उन्होंने बताया, खाने से पहले अगर योगा कराया जाए या पढ़ाने से पहले कुछ फाइन मोटर स्किल्स और इन सब चीज़ों का अगर ध्यान रखा जाए. इसके अलावा डॉक्टर जयचंद्रन का कहना है कि सेफ्टी ऑफ चाइल्ड इज़ द प्राइम ऑब्जेक्टिव, फर्स्ट गोल. हर जगह पर बच्चे की सेफ्टी का ध्यान रखने की भी बहुत ज़रूरत है. Now we will
one more
Yes.
addition, madam.
Yes.
I'll take 1 minute with your permission. There is in the list I find another thing called imitation. I know we will run out of time, but I would like to state that here itself. Now we talk about inclusive program everywhere, and I know this question is going to come up anytime, either by Dr. Hemalata or even Janahi herself may raise the question, because we are also working in the inclusive program in a big scale. Okay, here I would like to tell, we were trying to include, not integration, include a person in the mainstream school, Down syndrome boy. usually a well-groomed boy. And we have convinced the parents, convinced the peers, convinced the administration of the school, made him this, I have told everywhere because it's a tremendous success. We made him class people leader for the 3rd A class, 3rd section. And you know, his asset is imitation. Any Down syndrome child will imitate the teacher, will imitate the father, or will imitate some cinema star. You see any Down syndrome children performing, they will be imitating the film actor. So, we made him the class people leader, and we made him to imitate indirectly as the teacher, as the monitor of the class, the chief of the class. And the morning he comes early, well dressed, and he says, shh, don't make noise. Shh, all of you sit, stand in the line according to your height. This is how a best practice a special educator should pick up. What is the asset for the child? How to use that asset? Not just for some drama purpose or to give some yoga practice. Down syndrome children the muscles are very flexible. Don't use them to loosen the muscle further, but give them a chance to imitate, to asset, to enhance their self-esteem so that they can be part of the class. They will be intimate with others, and that's how you use the strategy also. Maybe, madam?
डॉक्टर जयचंद्रन ने अभी बताया कि किस तरह से उन्होंने एक डाउन सिंड्रोम वाले बच्चे को एक इंक्लूसिव सेटिंग में पढ़ा रहे थे, जब उसको पढ़ा रहे थे तो उसको क्लास का एक मॉनिटर बनाया गया और उसको ये उम्मीद की गई उससे कि वो टीचर को इमिटेट करेगा और क्लास का मॉनिटर था, तो उसने बहुत इफेक्टिवली अपने काम को किया। तो उनका ये कहना है कि जो बच्चे की पोटेंशियल है उनको हम क्रिएटिवली और अच्छे तरीके से इस्तेमाल करें ताकि वो बच्चे की लर्निंग में और उसके सेल्फ कॉन्फिडेंस बिल्डिंग में मदद कर सके। नाउ विल मूव टू आवर अदर क्वेश्चन. Dr. Jayachandran, I'll ask a question. As a special educator, how can we document the program and the progress of the program?
Yes, this is one of the weak points. Janaki, could you run through the few slides so that we can talk about the documentation?
Yes.
And before that, before we project that, I will just talk. Start. Okay. See, what you see on the screen is a profile, and this talks about the activities. That is the green color, preschool program, primary, next color, secondary, and pre-vocational. And once you assess the person, it gives a picture. And next one, you have the assessment done, carried out. Okay, and okay, next to profile you have Janaki. Now, anyhow, once you assess that person, what are the goals you are going to teach? We have developed a document. What are the objectives, specific objectives in the next 3 months you are going to teach? Then how you are going to write your individualized program, that is another document available, and how you are evaluating the program, it's all documented. The forms are available, and it's simple, easy to do by anyone, whether it's a special educator or a parent. And I must share this. When we mark what they can perform in red and in blue, and what they are yet to perform in red, some of the grown-up mentally challenged or persons with, I don't use the word challenged because I just saw her and used that, persons with mental retardation, adult women, they came and asked me, sir, what are you doing? I'm writing what you are performing, what you are yet to perform. After 3 months, they came and told me, now I'm doing it. Mark me that I have achieved. So, this is a kind of, that is also a teaching strategy. Display their progress. It's also helpful. So, documentation is one of the weakest section in the field of special education. I tell you, we have in all the scales, whatever we have developed, it is easy to document it, easy to project the progress, and only thing, what the special educators learn in the DSCMR or BEd, they have to use it. If they use it, I think the documents are available. Okay, next.
I would like to add on, your hands are on with imparting skills to the students, but most of us are not giving so much importance to record what we have been doing. It stands as a reference or ready reckoner at any given point of time when you really do the documentation work. Whatever with intention that we are planning or we are going to do for the child, is if it is recorded in future also, that stands as that gives us a preamble, feed forward for the next level of planning. So documentation is a very important and very instrumental component in your whole program planning. That's
Yeah,
And,
Doctor,
Yeah,
yes.
I will add this. I will add one more. It is not to brag that Tamil Nadu we are yet to do so many things, but the commissioner has already written that unless you show the document proof for their development, if there is a failure, why they fail, because of too much absenteeism or too many epileptic attacks, something like that, with authentic proof, probably the recognition for that institute will be in question. So the funding agencies, the accrediting agencies, they need a good document from you for the good practices, what you have for the children, what you impart for the children.
या डॉक्टर जयचंद्रन जैसे अभी बता रहे थे कि डॉक्यूमेंटेशन जो है जनरली स्पेशल एजुकेशन एरिया में एक बहुत वीक पार्ट है, जबकि डॉक्यूमेंटेशन की बहुत सख्त ज़रूरत है. इससे बच्चे को बहुत फ़ायदा होता है, स्पेशल एजुकेटर को ये पता चलता है कि बच्चा किस लेवल पर पहुंचा है, क्या अचीव किया है. और उनका जो एक सुझाव है कि इस डॉक्यूमेंटेशन को बच्चे ने क्या अचीव किया है गोल, अगर उसको डिस्प्ले किया जाए तो बच्चे के अंदर भी एक कॉन्फिडेंस आता है कि देख मैंने ये सब सीख लिया है. और जो मैंने खुद भी चेन्नई में जाके जो देखा है कि वहाँ ज़्यादातर इंस्टीट्यूशंस में इस स्केल को यूज़ कर रहे हैं और उसको डिस्प्ले भी किया जाता है, तो इट इज़ अ गुड प्रैक्टिस. हम लोगों को इसका ध्यान रखना चाहिए, बहुत सख्त ज़रूरत है.
Let me share what a document should contain. It's a profile, whatever the assessment, the skill set, where the child is at what level, and then your goal planning sheet, and then with specific objectives under each broad 18 goals, developmental goals, and what strategies and what methods you are going to adopt in implementing your program, and lastly and more importantly the evaluation. Whatever is the outcome, whatever the learning outcome that has been established, that is also recorded there. This is what a documentation process should contain, the whole collection should contain.
Yeah,
Thank you, Janai. I forgot to tell that, but you are a good student, so you could recollect that. Okay, the next one.
Yeah.
Oh, you are Hindi.
No, Hindi I have translated.
Yeah.
Now I'll ask a question from Janki. Are there any specific approaches in imparting the training to children in MR?
Yeah,
Can you
briefly,
be
yes.
brief?
Yeah, there are a number of approaches, but to name a few, like there are Montessori methods, there are playway method, there is a project method, and different people use different kind of approaches. But whatever is working with the child, whatever is successful for you to reach the child, that approach is the best approach. And if we always think about classroom teaching and its structure is very important for them, but sometimes you learn so much, you pick up so much in avocation, you kind of extracurricular activities also. That also these children need to be exposed. They should also have cultural activities, they should also go to arts exhibition and all that. They learn so much from those avenues. We should also explore other avocation activities or extramural activities for them. That is also very much I am seeing is lacking in many schools.
A brief comment on the things. Someone should not come and say that it's a flower therapy, it's a washing therapy, it is like that, It should be a proven method. Otherwise, we will not accept it. I really tell you, it should be a proven method. And many places you go, they say, no, we have achieved great success with this. Whether it is replicable in a generalization. Then only we will accept it. I think at one stage, probably Madam RCA should come out with some kind of program that what is really working, what is not working. I think the time is running short.
Yes.
Madam has to ask few more questions and we will
Yeah.
run through
What
the
are
fast.
like अभी डॉक्टर जयचंद्रन और जानकी ने जो बताया है कि जो अप्रोचेस हैं वो इस तरह की होनी चाहिए जो रेप्लिकेबल हो सकें. ये नहीं है कि हमने एक बहुत छोटे स्केल पर उसको किया और भले ही उसमें हमें सक्सेस मिली या नहीं मिली, हमने कहा हाँ ये एक स्ट्रेटजी है, इसको अपनाया जा सकता है. ऐसी होनी चाहिए जो रेप्लिकेबल हो सकें. नाउ जानकी, कैन यू टेल अस व्हाट आर द क्लासरूम स्ट्रेटजीज, अदर क्लासरूम स्ट्रेटजीज?
Yeah,
Brief.
sure, I will.
Yeah.
Can we show the slide? Yeah, primarily when you look at classroom strategies, the points that we have to bear in mind is firstly the teacher's attitude. The teacher's attitude I have enlisted. Those are the very successful, I mean very positive attitude that you need to develop towards your commitment towards teaching the children. And then the materials that you use. The materials that you use,
Okay. Yes.
the materials that you use, that also should need to be innovative, creative, and it should be towards the goal. It should be very relevant to the task that we are going to apply for. And classroom arrangement is firstly very important. Adequate spacing, seating arrangement, ventilation, and materials location also. If you are going to keep the materials somewhere and allow the child to have a discomfort to take the materials and come back to the seat and become ready for the learning, then that is also a very clumsy arrangement. So material location, these are all the things, and also you should make a contingency plan. Like I expect as a teacher certain code of conduct in this classroom, and I expect my students to behave in this way. Whatever you need to ask, that you can ask in this way with me. Like that we have to make a contingency contract with the group also, that we need to clearly state them, help them understand about it. And if you look at reinforcement is all human beings, we all are intricate towards working towards certain kind of reinforcement, certain kind of rewards. So reinforcement is very important for these children. What kind of reinforces that you have to, primarily when you take an assessment, that time itself you do a qualitative analysis, what the child likes, what the child doesn't like, and then you go on appropriating it. So with proper reinforcer analysis, you can use a very successful way of teaching these children. And classroom management, how you are going to handle the classroom, again appropriate assistance, what kind of strategies that you are going to use, whether physical prompting, gestural prompting, verbal prompting, but whatever assistance that you are going to give, it should also be faded slowly, gradually, once the child is progressing towards the proficiency of the task. Then also whatever behavior that the child is going to exhibit in the classroom, in what way you are going to handle that behavior. Is it going to be certain behaviors we can ignore, certain behaviors we have to immediately attend, certain behaviors we have to really clearly intervene. So these things have to be thought about, and that's what I have enlisted here.
Yes.
Yeah.
We have got a call. Yes, please give the call. Hello.
Okay.
I think. Okay.
Okay.
Like. Yes, दे दीजिए. हेलो.
हाँ जी.
जी अपना सवाल पूछिए.
जी calling from Dahod, Gujarat Blind Welfare Council.
जी थोड़ा तेज बोलिए.
This is to inform you first of all that we have CRE students about 30.
Yes.
Along with the DACMR students watching this program. I would like to ask the experts that we have basic MR, MDBS, FACP as well as Upanian as the assessment scale. But which should be the best, which we should use for the children who are living mainly in the remote areas, like tribal areas, villages. And I will request Dr. Hemlata to translate the same in Hindi also, please.
Okay, sir. We can take on question directly.
Yes. It depends on the special educator's preference. All the scales they are familiar, and let her decide which scale is suitable for the tribal area. Okay.
डॉक्टर जयचंद्रन का कहना है कि सभी स्केल प्रॉपर बने हुए हैं और ये डिपेंड करता है स्पेशल एजुकेटर के ऊपर कि वो किस स्केल को प्रिफ़र करती है, उस ट्राइबल एरिया की नीड क्या है और उस हिसाब से उस स्केल को इस्तेमाल किया जा सकता है.
It's all available in Hindi also.
हिंदी में भी सारे स्केल्स अवेलेबल हैं. Yes, now Janki, Dr. Jayachandran, what
Yes.
are the enrichment programs?
Two comments on the classroom management.
Yes.
1 minute, I see the clock is running very fast again. You must have enthusiasm. And in the enthusiasm, in the best practice, if you see, someone would have taught, a psychologist would have taught the special educator, appreciate the children. For everything, if you say, good, again good, 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 you do it, the children will know that you are telling a lie. So, it should be appropriate. Otherwise, the children will not learn it. They will not like it. Then another thing is communication. When you communicate, hey bache, idhar aao, karo, kao, pivo. No, kaho, pivo ji. Come on, like that. With expression, if you tell, then only the children will follow. You have some problem, some stomach pain or something like that. Oh, the principal is looking at me. I have to do this like that. No way the children will learn. No, you must be very active. I will just narrate one thing. In one place, that too in Germany, when I was teaching, the girl liked me because if I speak Hindi, you all like me because you will put my IQ as 42 or something like that. So I was speaking German to a mentally retarded child. She felt she is better than me. That's truth. And such a profoundly handicapped child never produced anything in her life in the classroom, but I taught her to assemble a tube light, and that was displayed. The next day, you see, she brought her father, mother, brother, everyone and said, I did that. That's a small step for us, foolish step, but that's a mighty improvement for the child. You have to encourage the children in the classroom like that. Okay, time, yes.
डॉक्टर जयचंद्रन का कहना है कि बच्चे को जब एनकरेज किया जाए तो ये ज़रूरी है कि हम अप्रोप्रिएट तरीके से करें. ये नहीं कि हाँ हमने कहा बहुत अच्छा है, ठीक है, मतलब अगर जो जनरल कमेंट्स हम करते हैं वो ना करके स्पेसिफिक बच्चे के बिहेवियर और उसकी लर्निंग के हिसाब से हमें करने की ज़रूरत है. अदरवाइज़ तो बच्चे को लगेगा कि ये कमेंट तो टीचर रोज़ देता रहता है और उससे बच्चे की लर्निंग में कोई इम्प्रूवमेंट नहीं आएगा. उन्होंने अपना जर्मनी का एग्जाम्पल बताया जहाँ पे उन्होंने एक स्टूडेंट को बताया कि किस तरह से ट्यूबलाइट को असेंबल किया जा सकता है और उस असेंबल की हुई ट्यूबलाइट को जब उन्होंने डिस्प्ले किया तो बच्चे को बहुत अच्छा महसूस हुआ. नेक्स्ट डे वो अपने पेरेंट्स को भी वहाँ लेके आई कि ये मैंने किया है. तो इस तरह की फीलिंग्स इनकलकेट करने की ज़रूरत होती है और एक टीचर होने के नाते हमारे लिए ये बहुत ज़रूरी है कि हम बच्चे को ये बताएं, बच्चे को अच्छे तरीके से एक तो बता रहे हैं, एक्टिवली पार्टिसिपेट कर रहे हैं, सिर्फ इसलिए नहीं कि बीइंग ए स्पेशल एजुकेटर आई हैव टू बी इन द क्लास, हमें क्लास में होने की ज़रूरत है, इसलिए नहीं, बल्कि इसलिए कि हमें एक्टिवली हम किस तरह से सिखा रहे हैं, हमारे क्या जेस्चर हैं, क्या हाव भाव हैं, किस तरीके से हम इस्तेमाल कर रहे हैं बात करने में, बच्चे को सिखाने में, वो सब चीज़ें मैटर करती हैं. समय की कमी है, मैं चलते चलते डॉक्टर जयचंद्रन से एक छोटा सा सवाल पूछना चाहूँगी. व्हाट आर द इमर्जिंग ट्रेंड्स इन स्पेशल एजुकेशन सर?
Definitely inclusive education, if you single out, and I think we are just progressing very well in this. Believe me that in the district of Ramnad, the most backward district, considered to be a most backward district, but our President of India hails from that place. We have included about maybe about 780 persons with mental retardation in the mainstream program. They are from 6 years to 14 years, and you have to see that to believe it. Only thing, the special educator should open his eyes with one point. The children are willing to learn and they are eager to learn. They know they have difficulties, crippled. They are crippled because of their capacity, physical and mental capacity, but you have to give them a helping hand and they will learn to their potential. It is the duty of the special educator to do it. I think inclusive education to stay here.
डॉक्टर जयचंद्रन का कहना है कि जो फ्यूचर ट्रेंड है वो इंक्लूसिव एजुकेशन का है और किस तरह से रामनाथ डिस्ट्रिक्ट में उन्होंने 700 से भी ज़्यादा बच्चों को इंक्लूड किया है, जो एक बहुत अच्छा एग्जाम्पल है। बच्चे सीखना चाहते हैं, उनके अंदर कैपेसिटी है, ज़रूरत है कि टीचर उनकी पोटेंशियल को पहचान कर विलिंगनेसली और इच्छा से और क्रिएटिव सक्रिय तरीके से अगर उनको सिखाए तो बच्चे बहुत कुछ सीख सकते हैं। अब चलते चलते बहुत आई वुड आस्क व्हाट मैसेज वुड यू लाइक टू गिव टू आवर स्पेशल एजुकेटर इन ब्रीफ?
Yes,
हाफ अ मिनट।
the special educator should open their eyes widely, observe the child's potential, motivation to learn, eager to learn, prepare the appropriate teaching strategies, materials, and arrange the congenial atmosphere for the child to learn. The child is bound to learn. And it is in your hands, it is in your hands. I repeat, if the child fails to learn, how my lesson plan prevented the child from learning. It's not the child who has problem, it is we who have problem to restructure the program. I think
Thank you.
Janahi has prepared a conclusion, and as usual I cannot say this, but in one of the oldest literature it says in Tamil, it is not the teacher teaches the skill, but it is his experience counts. I say that, may I through the guidance of the right teacher see the truth prevailing for the children with mental retardation in the animate and inanimate in the vast cosmic space. How to read that in Sanskrit? Do that, Jahnavi?
सर वी डोंट हैव टाइम।
One.
थैंक यू। आज की चर्चा में हमें डॉक्टर जयचंद्रन और डॉक्टर जानकी ने बहुत ही महत्वपूर्ण जानकारी दी और हमारे पास समय की कमी है, नहीं तो हम इस चर्चा को और आगे बढ़ाते। यदि आपको इस विषय पर कोई और जानकारी चाहिए तो आप डॉक्टर जयचंद्रन से संपर्क कर सकते हैं। आपका पता है डॉक्टर पी जयचंद्रन, डायरेक्टर विजय ह्यूमन सर्विसेज, नंबर 4 लक्ष्मपुरम, 3rd स्ट्रीट, रॉयल पेट, चेन्नई 14। फ़ोन नंबर है 281101100640। आप ईमेल के द्वारा भी सवाल पूछ सकते हैं। यदि आपको और अधिक जानकारी चाहिए तो आप भारतीय पुनर्वास परिषद में भी लिख सकते हैं। और हमारी अगली टेलीकॉन्फ्रेंस होगी बेस्ट प्रैक्टिसेस इन टीचिंग चिल्ड्रन विद विजुअल इम्पेयरमेंट। इस विषय पर जानकारी देने के लिए हमारे साथ रमन्ना महर्षि इंस्टीट्यूट बेंगलोर से विशेषज्ञ मौजूद रहेंगे। अंत में मैं अपने दर्शकों, अपने व्यूअर्स और EMPC के कर्मचारियों को धन्यवाद देती हूं, जिनके सक्रिय सहयोग के कारण हम इस कार्यक्रम को सफलतापूर्वक संपन्न कर पाए। और चलते चलते मैं यही कहना चाहूँगी जो डॉक्टर जयचंद्रन का भी कहना है कि एज ए टीचर हमें ये ज़रूरत है कि हम किस तरह से क्रिएटिवली बच्चे को सिखा सकें, उनकी पोटेंशियल्स को पूरा तरह से इस्तेमाल कर सकें। अगर बच्चा नहीं सीख पा रहा है तो उसमें बच्चे की कमी नहीं, इसमें हमें ये देखना चाहिए कि हमारे कम्युनिकेशन में कहाँ कमी रह गई कि हम उसको सिखा नहीं पाए।
I have a final message. A teacher does not limit within the boundaries of classroom. She has to open up, she has to broaden her horizons and see the child in the home situation or in the growing years, and in future also she has to expand her roles and cater to the needs.
Why don't you read the Sanskrit couplet? 2 seconds if you
it
give.
says Sakhanda Mandalakaram Vyaptam Yena Characharam Tatpadam Darshitam Yena Tasmai Shri Gurave Namaha. That's how we prostrate at the feet of Guru. So what Guru has to do is foremost important for these special children.
धन्यवाद।
Thank you, madam. Thank you,
Thank you,
for the crew. Thank you very much.